I try to imagine a fellow smarter than myself, and then I try to think, what would he do?
Charge up your axons, ready your receptors, and shift your lobes into upper beta phase. You are listening to Smart Drug Smarts, the podcast dedicated to helping you optimize your brain with the latest breakthroughs in neuroscience, nootropics, and psychopharmacology.
Hello and welcome to Smart Drug Smarts. My name is Jesse Lawler. I am your host, and this is the fourth Overdose edition of Smart Drug Smarts. We have not had an Overdose edition in quite some time, but we reserve the right every now and then to throw in a little episode between our normal episodes. This one will not be hitting on a Friday as usual. It's a little bit shorter than usual, doesn't have all the extras and gewgaws that we normally throw in, but sometimes we have a topic that just doesn't quite fit, or at least doesn't fit in the schedule. Plus the fact I just really like the name Overdose edition. We hadn't had one in a while, and this seemed like a good opportunity. Sliding a little something in before the end of the month of February. Short month, but we're going to have an extra episode here. And in this one, I'm going to be talking specifically about a gadget, a personal tracking gadget, which I've had the opportunity to use and test for about the past 6 weeks. Something called the Oura Ring. O-U-R-A is the spelling. It is a high-end biometric tracker made by a Finnish company, and I'm going to be talking with the founder and CEO of that company, Petteri Lahtela, in the main interview, which will be the meaty bit of this show. We're not going to have the ruthless listener retention gimmick in this one, but since you were kind enough to download the episode, I am going to have one little extra bit equivalent to a This Week in Neuroscience, and we'll jump right into that now, then followed by a quick interview and back to our regularly scheduled Friday programming. So a little bit of neuroscience, then on to Smart Drug Smarts Overdose Edition number 4.
Smart Drug Smarts, This Week in Neuroscience.
So you cannot be blamed if you have not yet heard of something called the boba-kiki effect. But this is something that was first identified almost 90 years ago and has been replicated cross-culturally over the world and throughout the decades ever since. This idea is kind of weird, but it's that nonsense sounds can kind of correlate to different shapes in our imagination. And it's something almost a little bit reminiscent of synesthesia, when a color can have a taste or a sound can have a smell, that kind of thing. But in this case, the name boba-kiki is because the nonsense word boba kind of has a round, bouncy sort of sound to it, and kiki kind of sounds sharp and angular and jutting. You can kind of imagine that yourself just by saying this word or rolling it around in your head. Of course, boba and kiki are not the only two examples of this, but they're just standout examples, and unlike a lot of scientific theories that get named after the researchers in question, this one is actually named after nonsense words. But researchers at the Duke NUS Medical School in Singapore were wondering at what level of neural processing the correlation between a sound and a shape actually takes place. So they cooked up several different visual experiments where people would have a distracting image played in their eyes, like things flashing really, really fast in their dominant eye, and meanwhile you would have a word slowly fading in your non-dominant eye's field of vision. And the research participants would have to say when they could identify the word. And now the word would appear inside a shape, so imagine the word boba, and it might either be in like a spiky star shape or in more of an oval, round, amoeboid sort of shape. They tried lots of different variations on this experiment, and time again, people were able to recognize the word first. It would make its way into their consciousness where they could actually report that they see it to the researchers more quickly if it appeared inside of a congruous shape. So if the word kiki, a sharp word, appeared in a rounded shape, it would take longer for the subjects to report it than if it appeared inside of a spiky star shape, and vice versa. This was a consistent finding across people, across ages, and it wasn't just the words boba and kiki. You can kind of see in those words, like the letter B has these big round bulbs when you write it, and K is kind of a spiky letter. So maybe there's something visually with the way that we write those words in Roman characters that's a confounding factor. They actually taught people to read for some of these experiments nonsense letters that didn't look like our English letters and didn't have any visual correspondence between the type of sound and the way that the letter appeared on the page. Reran these same experiments and got the same result. So it's anybody's guess as to why the boba-kiki effect happens, where exactly that's coming from. Hard to imagine that this is a trait that was selected for, but it's probably more like a spandrel in evolutionary terminology. But really interesting that what these experiments show is that the priming effect of seeing a certain type of shape is allowing people to recognize the word more quickly. Says the study's lead author, Xiaomen Hung, this is the first report that congruence between a visual word form and the visual properties of a shape can influence behavior when neither the word nor the object has been seen. All of these findings expand the limit of unconscious processing, demonstrating that cross-modal mapping occurs outside the realm of conscious awareness. He then breaks that down into a synopsis that might have been appreciated by Lewis Carroll. A word can sound like a shape before the shape has been seen.
Smart Drug Smarts, the podcast so smart, we have smart in our title. Twice.
So I'm about to be speaking with Petteri Lahtela, who I first met back in November of last year in Finland. Petteri himself is a Finn, but more important, he is the CEO and founder of Oura, and as you'll hear in the coming interview, has a long personal history in the biometric tracking space, even preceding his starting this company. So the Oura Ring is part of the same family of devices that you would consider things like the Fitbit or Jawbone Up, but unlike something that goes on your wrist, this is actually a ring, so you can wear it on one of a couple of fingers. I've got mine on my ring finger on my right hand, and they've managed to fit a pretty amazing amount of technology in a really small package. And by having it on the ring, there's better access to blood vessels very near the surface than something that's worn a little bit more loosely on the wrist, which has some real upsides when it comes to tracking your own personal data. I got my Oura in the mail just around the first of the year, so I've been wearing it for about 6 or 7 weeks now. Did this interview with Petteri Lahtela just a couple of weeks ago, but the ring has been holding up really well. I'm a really satisfied user, and it's also been kind of fun watching the mobile app. Almost any device like this now has a mobile app attached to it, and seeing pretty frequent updates to that mobile app come out as they tweak little things within the app. They're capturing a lot more raw data than is actually displayed for the user within the app, but it's interesting from sort of a technologist's eye view to see the things that they think are relevant to actually show to the user which pieces of the data are actionable enough where it makes it into the app, which is fairly minimalist. I'll put some screen captures from my own app on the webpage for this episode. Since this isn't a normal episode but an Overdose edition, it'll be at a slightly different URL, but everything you want to find here you can see at smartdrugsmarts.com/Oura. That's spelled O-U-R-A. And also put up a couple of pictures of this thing on my hand so you can see the size of it. It's a pretty big ring as rings go. I'm not a big ring guy, but kind of makes me feel like a gangster mafioso with a ring this size on my finger. Mine is the chrome black model, but they've also got sort of an iPod white and a matte black. But the most exciting thing about this ring is actually what it does, especially in sleep tracking and heart rate variability. It's capturing a lot of metrics, but rather than me waxing about that now, let's jump in with Petteri Lahtela.
So my background is first 14 years I was in telecoms business. We grew a company to a global market leader in a couple of product segments. But then I really wanted to start doing something for the well-being of people. In 2005, I joined a company which was developing IT systems for chronic diseases management and prevention. So at that time, I had used polar heart rate monitors during my sports career earlier on. So as long as they've been there, I've been using them. But then when I digged deeper into the physiology behind the chronic diseases and the reasons behind chronic diseases, chronic stress, for example, then I started to measure myself in plenty of different ways and doing continuous measurements over the several weeks to understand that how my body responds to my lifestyle, and also that what I can do to help myself to recover from daily mental and physical strain. In the life situation when I have kids to take care, I have family, I want to be at my best in my work, but also I want to stay healthy and balanced. So it was my personal question and also my co-founder's personal question that, okay, how we can measure and improve the recovery from daily mental and physical strain so that we can maintain health and performance and balance. So how we build the connection between our behavioral choices to our body responses. That was the kind of key question for us.
Tell me about the design of the Oura Ring itself. As far as I know, you're the only ring in this space. What made you go that direction and not the more traditional bracelet or something else, someplace else you could be accessing data from the body?
Yeah, so when we started developing the solution for these core questions, we had already experience on the marketplace with plenty of different kind of products that measure the physiological reactions of the body in different ways, like Polar products or other, many of them are Finnish products. Mm-hmm. But anyhow, we were already quite deep into those. And also that our chief scientific officer, Hannu Kinnunen, he has 20 years of background in developing algorithms and biosignal detection-based analysis on the consumer products at Polar Electro, which is the world's leading heart rate monitoring company. They actually created the whole heart rate monitoring business, pioneers in wearables. So we had already kind of a comprehensive understanding about the marketplace, but none of the existing solutions, even though all of them have some good features, but none of them gave a good answer to us in the context of getting accurate enough data in a comfortable way, 24/7, and in longitudinal way. We needed to access the body's physiology in a highly accurate way, and also it needed to be very comfortable so that it doesn't disturb the user, so that we get longitudinal data 24/7. So it means weeks, weeks and months and years of data. We developed plenty of different kind of prototypes, but eventually we developed a prototype on the pulse oximeter, measuring from the fingertip, and we found out that actually the data from there is very good in quality. We developed own software on that, and then we started developing a prototype. Then we came up with the idea a few years back that, okay, why don't we make it as a ring? And of course, that time, no one believed that it's doable, because even the CPU chips, which has the Bluetooth functionality and so on, they were completely too big in that form factor. So the first kind of prototypes were very big.
More like brass knuckles than a ring.
Yeah, exactly. So, but then fortunately, components started to develop, and they were smaller sizes coming, and we were maybe the first ones to apply them, and eventually that supported us to make it work as a ring as well.
One thing I will say is that I've been really happy with how impervious to scratching and damage and anything like that the surface is. There have been a couple of times in the month since I've had it, I've looked at the surface, I've just scrapped it against something pretty hard and been like, oh man, I'm sure I hurt it. And it never has. It's always just buffed off with my thumb and it looks perfect underneath. Pretty impressive, the exterior design.
Yes, so we were passionate to really solve the wearing comfort question and also that making it really robust, because it's a ring, it needs to be robust and needs to be beautiful and nice to wear and so on. And of course, the main thing is that what's happening inside, how we can access the necessary biosignals and combine all that, or process the information there in the ring, and then just deliver the data to the mobile to visualize it.
So just to do a rundown of the signals that you're actually pulling out of the ring, you're getting pulse, body temperature, you're getting a certain amount of movement data, although the app doesn't seem to track you from place to place, so I'm not sure if it's grabbing anything GPS-wise. What else are you pulling out of the data?
So the main thing is that we get the pulse waveform and also the pulse amplitude variation, which is a reflection of blood pressure variation as well. So we sample in 250 hertz, so 250 samples per second, and we get the full drawing of the pulse waveform, every detail of it, and then the pulse amplitude variation, and we can derive the interbeat interval, which is the basis for the heart rate variability calculations, and then body temperature variation between the nights, and then respiration rate, breathing variance, and then all the movements, even the slightest movements during the night and during the day as well.
One thing I've really noticed is it does a great job of figuring out when I'm going to sleep and when I'm waking up at night and in the morning, but it doesn't identify naps. And I'm wondering, or it does such a good job at the former, I'm wondering why it doesn't do the latter.
It does the latter as well. From the very beginning, it has measured, we call them resting periods during the day. So whenever you stop for 1 to 2 minutes, if you take naps or you meditate or you just sit down or whatever, it starts to measure your pulse automatically. But the current app doesn't show the naps yet, because whatever we show in the app, we want to scientifically validate everything, like we have done for all the raw signals have been scientifically validated. Also, the hypnogram and the sleep quality measurement, sleep staging, they are scientifically validated, not only by us, but also several research organizations outside of us, which are top in the world. So in the context of naps, our passion is to really tell you whether you entered the REM sleep or deep sleep phases during your naps. But actually, the status in the marketplace, based on the research, is that there actually isn't much research available of naps, and we had to do it ourselves. So we have been doing it during the last year. We have been doing with the Occupational Healthcare Center in Finland, in Helsinki, that there are nurses coming to sleep in the sleep lab after their night shift, and we measure their naps and with the ring and the polysomnography, so that we get real comparison that what sleep stages they enter during their naps. That's why we've been holding back in showing the data. Of course, we could have taken the shortcut and just show something like your pulse information and something of your naps or resting periods. But those are already captured by the ring, and we will bring them visible. So you will see them eventually when we update the apps.
I kind of actually like how the app is fairly minimalist in what it presents, just so it doesn't drown you in data. Capturing data at 250 hertz, there's obviously a lot there. And I think if you showed everything within the app, people would wither under the data storm.
Yes, so actually it is the big challenge that the data is so rich and there is so much of the data. So actually it's one of the most complex issues to solve, that how we visualize all that data and bring up the correlations between different things so that we don't overwhelm the user. Still, for us, it's a huge challenge that how we make it so kind of intuitive and easy to understand for different kind of audiences.
Let me ask you some about the measurement of activity. I've got a couple of questions there. Like, I do several different things for exercise. Some days I'll be in a gym lifting weights, and other days I'll go out running and get more cardiovascular stuff. The measurement of activity, to me, seems very biased in favor of running. Like, it gives me a giant spike on my activity meter when it sees that Jesse's gone out and ran, 5-10 kilometers, whatever it is, versus what feels like an equally vigorous workout where I'm stationary and just lifting heavy objects.
So our activity measurement is based on calorie calculation, kind of continuous calorie calculation. We use MET and MET minutes, so metabolic equivalent, and its derivative is MET minutes. So it's for classifying the physical activities based on the actual intensity and impact from the calories perspective. So it's a common measure used to express the energy expenditure and intensity of different physical activities. So for example, if MET value of a specific activity is 4, it means that you're burning 4 times as much calories as you would burn while resting.
So it's recommending that I aim for 9 kilometers per day of moving around. Where's that number coming from?
Yeah, so that number, and actually Oura is the only product that gives you the daily target for your activities based on how well you have recovered during the night. So one of the main purposes of the product is to help you build balance between your load and recovery. So if you haven't recovered during the previous night or previous nights from your load. And the load, in this case, it can be both mental and physical load because the physiological response is the same. So if you haven't recovered enough, then it gives you lower activity target for the next day. And so it helps you to build kind of long-term balance between your load and recovery. And that is kind of a direct analogy from athletes, that how athletes develop their capacity over the time and performance. So they load themselves and then recover and load again and recover. So then they can maintain and even increase their capacity over the time. And this is the same analogy here as well.
I've used a couple of other trackers which are probably looking at sleep in a different way. The Oura shows quite a bit more REM sleep in my own personal sleep pattern than I was seeing in some other devices. I'm wondering how the various stages of sleep are measured.
Yes, we need to remember that we are each unique. So we are individuals who are unique, and our genetic heritage is different, and also life situations change over the time. So actually the optimal is only for you. There's no such thing for everyone. That's what we have learned, especially during last year with having all the users in more than 50 countries and seeing the data. So we can clearly tell that the sleeping patterns are hugely individual. Even within your own context, the variance comes from that how much mental load or physical load you have during the days, and also how well you keep up with the rhythms, going to bed and waking up, or whatever meal times, light exposure and exercise rhythms and so on. So we are rhythmic animals like any mammals, and the light is affecting us. Basically, it's adjusting our many of the internal functions and biology. So now I'm talking a little bit about chronobiology in this context as well. So many things affect your sleep patterns, and it's for each one of us, the patterns or hypnograms that you can see. So how much deep sleep, when you reach your deep sleep, and also how much REM sleep, light sleep you get, and how much wakefulness there is during the night, so how restless it is. And also kind of sleep onset latency, basically all the contributors that are reflected by the app. They are unique for everyone. There are, of course, some kind of a general recommendations by National Sleep Foundation and so on, all the kind of organizations in the context of sleep. But we need to understand that they are mostly based on the research in the context of individuals sleeping one night in sleep lab.
Yeah.
So how much they really tell about your sleeping patterns and the variance of your sleeping patterns in the normal daily life context. Because when you go to sleep lab, there are strict rules that that you shouldn't do this and that, you shouldn't eat this and that before you go to the sleep lab.
Yeah, and you're sleeping in an unfamiliar environment, so it's probably not really a representative night for you anyway.
Yes, and every professional sleep scientist or sleep clinician, they know that, and they admit that that's the case. So mainly the sleep lab is definitely, it's necessary and it's needed for detecting and diagnosing, for example, sleep apnea and some sleep-related problems. But for majority of people, just for improving sleep in their normal daily life context, it's most relevant to look the patterns and the changes in the patterns in the context of yourself. Then do some trials that, okay, if I change my behavior this way, do I see more deep sleep or more REM sleep? If I adjust my sleeping times, so if I go to bed a bit earlier or wake up a bit earlier, then how it affects my sleep quality. Also, how I subjectively feel about that. So in the context of research and science of sleep, we don't actually know so much about sleep in the kind of longitudinal phenomena, normal daily life. So that's why Oura is a reflection of a measurement, which is very, very close to the sleep lab in the quality of the measurement. So that's what we have been validating and what is the result from the validations, that this is the most accurate sleep monitoring device that can also detect the sleep stages, including the REM sleep.
I imagine in a lot of ways, the formal sleep scientists are probably indebted to companies like yours that are getting massive data streams that they wouldn't have had available from single people in a lab a handful of nights. I mean, you're getting data pouring in from however many users you have now, which is probably something new in the history of sleep research.
Exactly. And that's why we already have, as we call them, kind of B2B cases. We have plenty of universities and research labs and sleep labs and so on that are partnering with us and other companies who very well sleep is one of the core things. So we are overwhelmed with the inquiries coming from different universities and research organizations, mostly from the US. So most of our sales, more than 70%, comes from US, but we have customers in more than 50 countries. But we concentrate in the US market, and there we have most of these research partners as well. For example, Mount Sinai Hospital in New York, which is one of the most renowned research hospitals in the world, they use in 2 different departments, they use these rings in the sleep measurement and in the context of kind of Parkinson's study and so on.
Have you found in looking at your data sets any difference in the way people sleep or maybe the quality of sleep between high and low latitude people, like geographically where they live? For example, you're in Finland right now, quite a bit closer to the Arctic Circle than I am here. Is that come across in people's sleep, just the length of the nights there in the area?
Of course, the amount of light is affecting to some extent the sleeping patterns. We don't get that much light exposure here during the winter time, so it has its own effect. But we haven't had time yet to really explore and do this kind of analysis on the data that we have in the cloud. So we already have more than 500,000 nights and days and physiological responses. All the data is there in the cloud, but we haven't been able to dig deeper into such kind of details. But definitely there will be very interesting data points and cross-correlations that we will be finding out from there eventually. So we are gaining that kind of information in a continuous basis from our users.
What do you think people find that is most surprising to them after they've been using the Oura for a while and looking at their data?
Maybe one of the things is that they find the nighttime resting heart rate, what it indicates. Because nighttime resting heart rate, it clearly and quickly shows the reaction of your body to different kind of things, what you do in your life. So if you take some alcohol, for example, in the evening or even the previous day, whatever, or for some people drinking coffee after noon, it has huge effect. Or if you do some high intensity exercise too late in the evening, all of those, there are examples that they have quite a big effect on how your resting heart rate is developing during the night and how well you recover during that night. So people have been able to kind of build correlations between things that they do during the day, that how they are reflected by their sleep patterns and also the heart rate dynamics during the night.
Would you recommend that when somebody first gets their Oura, they maybe do like 6 weeks worth of 1 week experiments, like maybe go a week without coffee or something like that, to see how that affects their numbers and if there are things like that in their own personal physiology they should be aware of? I'm wondering this now. I haven't gone without coffee since getting the ring, but now I'm wondering that might be a good little experiment to run.
Yes, definitely, because people have been doing those experiments and they have told us. So we continuously get that kind of information from our users. They are kind of extremely intrigued about their findings. For example, for some people, eating too much or too heavily after 6 p.m., it may increase 4 to 5 beats per minute, your resting heart rate during the night. One of my colleagues has that kind of a chronotype that he shouldn't eat after 6 p.m. anything heavy. So when he did that experiment, he did some genetic test based on that. He wanted to try and saw clearly a big difference there. And also that he's been losing 2 kilograms of his weight in a few weeks' time just by changing the rhythm of having the meals. So our kind of passion is to make visible that kind of things that are invisible in most of the cases. The question that we want to answer is, how should I adjust my behavior and daily rhythms to improve sleep quality and recovery from daily mental and physical strain? Oura is the only product that can tell you in the morning when you wake up that if you had fever during the night, if your body temperature was abnormal, or if any other body responses, if your resting heart rate was abnormal or you reached your lowest resting heart rate in abnormal time, sleep pattern was abnormal or something like that. We are continuously developing the app, so within the next few weeks you will start seeing heart rate variability related things and also body temperature related curves, so we can even show the menstrual cycles for women through the body temperature. And we will start kind of building correlations between different things, trying to bring them up in the app in more detail. And we are building up kind of a completely new concepts to the app as well. And at the same time, building the dashboard to the web so that you can access all the data.
Cool. Yeah, I meant to ask about that because it seems like there is such a large data set that could eventually be dipped into there. It'd be nice to look at historical stuff, which is sometimes hard to fit on a small screen.
Yes, exactly. So we have had data API available for our research partners for more than half a year already, and they have been using that to access the data and correlating with other stuff they have collected. But then this dashboard will be available for everyone and so on, so that they can really explore whatever number of people and the coaches as well. So like we have many coaches, they have clients that they are coaching and doctors who are using Oura for their patients or clients as well. So then they can access the data remotely and give their recommendations that what to do next and see continuously that how their body is responding to the lifestyle and what kind of changes should be done, and in a very, very easy way.
Smart Drug Smarts.
So thank you so very much to Petteri Lahtela for taking the time for that conversation, also for sending me an Oura ring, which I very much appreciate. It actually occurred to me as I was recording this episode that the first time I saw the Oura ring was not in Finland, but actually at the Quantified Self Conference in San Francisco in 2015. A slightly earlier version, I think, but their first iteration of what they had just completed off of a Kickstarter campaign. Oura was a Kickstarter-born company. I think they raised about $600,000 in their initial go-round, and just recently at the end of last year did a bigger round of funding as they really got ready to roll out to the US market. The ring is not exactly cheap. It's in the $300 to $500 range depending on the model you get, but it is definitely one of the top things out there in the personal tracking space. And based on the number of researchers that are actually using it for ongoing studies and data capture, that's a pretty good sign on the overall quality of this thing. I have been using a sleep tracker of one form or another ever since the Zeo back in, I think 2011 was my first sleep tracker. It's definitely an improving technology, but the Oura is the best thing I've seen as far as noticing without me telling it when I'm taking a nap, when I'm waking up in the morning. It really is paying close attention. The one thing worth mentioning, I know people are going to ask, is what's the battery life in this thing? How much battery can they really fit in a ring? And the answer is about as much as you'd expect. I have to recharge mine probably a little more frequently than once every 3 days. Seems like sort of a 2.5 days till it runs down. And I get a notification on my phone saying, hey, make sure you charge the ring before bedtime. But the good news is it charges pretty fast. There's no data obviously, during the time that it's charging because it's off your finger, but it charges off a USB cable and a little charging dish. I've got that plugged into my computer, and it seems like somewhere around 30 minutes to get from a pretty low point to a full charge. And should you wish to get an Oura Ring yourself, we've got a discount code for Smart Drug Smarts listeners. That is SDS, as in Smart Drug Smarts, which will knock 10% off the sticker price, so save you $30 or $50. We'll have a reminder of that at smartdrugsmarts.com/Oura, the webpage for this episode. Now we return you to your busy week already in progress, and you'll hear from me again on Friday. So until then, stay smart.
You've been listening to the Smart Drug Smarts podcast. Visit us online at www.smartdrugsmarts.com and subscribe to our mailing list to keep your neurons buzzing with the latest in brain optimization. Smart Drug Smarts should be listened to for entertainment purposes only, although some guests on the show are medical doctors, most are not, and the host is just some random guy. Nothing you hear on this podcast or read at smartdrugsmarts.com should be considered medical advice. Consult your doctor and use some damn common sense before doing anything you think might have a lasting impact on your brain.